I'm Joan Cartan Hansen. Thank you for joining us for this Dialogue Web Extra. We're answering your questions about the novel H1N1 and seasonal flu with Dr. Christine Hahn, the state epidemiologist. Thank you for being here. I appreciate it. Let's go to some of our questions. First one is from William in Rockford, Washington. William, go ahead.
Hi, how you doing tonight?
Good.
I'm really concerned. I watched your show. I listened to all of the things that you said about the safety and testing and so on. 11 years ago, I had Guillain-Barré syndrome. I was in intensive care, had plasmaparesis. I 80% recovered. I've got a lot of neurological damage that never recovered. And I was told by many doctors that it was a result of a flu shot. I don't hear anybody mentioning Guillain-Barré syndrome. I, about 4 years ago, thought about getting another flu shot. The one that I got 11 years ago was the first time I'd ever gotten one. About maybe 5 years ago, I called my doctor and said, hey, bone up on the Guillain-Barré flu shot connection. I'm thinking of getting a flu shot. And I went to his office 3 days later. He said, oh, no problem, no problem. He gave me a brochure. I took it home. I read it, and on the back page it said, anyone with a risk of Guillain-Barré or a past with Guillain-Barré should not get a flu shot.
Okay.
You guys aren't talking about that.
Okay, let's talk about that.
Yeah, I'm happy to talk about that. Actually, I don't use that term much because other than people like yourself that have had it, it doesn't mean most people don't know what it is. But there's actually a very good website on this. The CDC H1N1 website has a whole page devoted to Guillain-Barré and what the symptoms are and what the concerns are. In Idaho, we've actually set up a tracking process. We're looking for that. And as we talked about just now about the swine flu vaccine, I didn't use the word Guillain-Barré, but that is the problem that happened after the swine flu vaccine that I referred to back in '76, as I imagine you're aware. So yes, you're right. We don't use the word a lot because I think most people be like, they won't remember it. But you're absolutely right. And people like yourself that have had Guillain-Barré in the past, it is recommended generally that they don't get any more flu vaccines. And one way you can protect yourself if, let's say, you get exposed to flu, and your doctor may have told you this, is to go on this medication, the antivirals, to prevent getting flu, especially if you need to be, for some reason, you're in an area where you might have been exposed to flu that you couldn't help it.
If you have an egg allergy, should you not take the shot?
Correct. Egg allergy is another contraindication because this vaccine, just like seasonal, is grown in eggs.
Okay. Let's go to Amanda in Nampa. Amanda.
Hi, my question is about me and my son. We are both currently sick with pretty much all of the symptoms except for a fever. I thought I might have had a fever for a couple of days, but stubborn me refused to take my temperature. And, I had the little eyes burning and you feel tired and kind of like wiped out. And anyway, my question is, we were given some extra refills by a doctor a couple months ago of antibiotics. Him is the amoxicillin, and mine is just a generic Z-Pak. We have a lot of chest congestion right now and sinus pressure and everything, and I also have nausea, vomiting, diarrhea, blah, 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 blah. And I was just wondering if this is going to help if I go ahead and take these prescriptions, and then also if there is a certain point when I do need to just go ahead and pull out the credit card and go without health insurance and get tested for swine flu, or just go see a doctor and get an antiviral?
Right. Very good questions. If this is the flu, and it certainly sounds like it could be, not everybody gets fever with it. Most people do, but not everybody. You sound very much like you could have it. In that case, those antibiotics per se won't help treat the flu. However, one of the things that flu does is it opens the door to bacterial infections. So sometimes people with flu then get a sinusitis or a pneumonia or something else with a bacteria settling in. So if you, one of the warning signs that we had talked about with flu, we didn't actually go through those slides.
Let's go through the emergency.
Yeah, let's go through those.
There's some emergency, warning signs for adults. Let's start with the emergency warning signs for adults. That's first one is difficulty breathing or shortness of breath.
Right.
Pain or pressure in the chest or abdomen.
Yep.
Sudden dizziness, confusion, severe or persistent vomiting. Flu-like symptoms improve but then return with a fever and a cough.
Right, and I want to focus for this caller especially on that last one. If flu-like symptoms seem to be kind of getting, maybe even you're feeling like you're getting a little better, the achies are going away, and all of a sudden you're actually kind of feel like you're going downhill again, that might be a sign that the bacteria is settling in. And that's a time when antibiotics can be useful. Your other question about possibly going in and getting, possibly for treatment, is it's probably too late. The antiviral medications, which can be very helpful, generally have to be started in the first couple days to have much of a benefit. So I think you'd be, certainly I don't want to discourage you from seeking medical treatment if you really don't feel well. But if you're just kind of lingering and you're not getting better as fast as you want, then taking antivirals at this point will not help speed it up in any way.
So at what point should you go ahead? Well, let's actually, before we do that, let's go through the children's sign, the warning for children,
Yes.
since you have a son. Fast breathing or trouble breathing, a bluish skin color, that's obviously really a sign for 911. Not drinking enough fluids, really push those fluids. The child not waking up or not interacting, that's also very serious. Being irritable, that the children doesn't want to be held. That's a big sign for if a child, and this is obviously younger children too. Flu-like symptoms that improve but return with a fever and a worse cough. So again, if you get better and then all of a sudden you get worse again.
That might be a sign
so
again.
When do you go to the doctor?
Yeah, I think that list is those lists that you just read are really pretty severe,
Serious.
and probably you might want to
911 or get in immediately.
Get in immediately. But even when to see a doctor for most people might hopefully be before it gets that bad. And I would say again, for people that have underlying health conditions, I think the bar should be set lower, because let's say someone has asthma or diabetes. You want to get in pretty quick, because that's when the antivirals are going to help you. So I would say if you have an underlying health condition, you know that you don't normally tolerate flu very well, in that case you might want to call as soon as you get the aches and the fevers and stuff, because you feel like you want to get on that treatment right away. If you're healthy, and usually the flu you can get through it okay, then I wouldn't necessarily seek medical treatment unless you felt like you were really, things weren't going well. You were sicker than you expected to be with a flu-like illness.
After 4 or 5 days.
Yeah, it might be a couple days, or you just feel like you're going downhill, or some of those warning signs you talked about.
Okay. Let's go to Amber in Twin Falls. Amber.
Hi, how are you?
Good.
I'm so glad you called me, or that I'm talking to you. I watch your show all the time.
Thank you.
I actually have a two-part question.
Okay.
One of them is I am an asthmatic with diabetes history in my family, and seasonally I am put on antibiotics and steroids because of my asthmatic flares. But the thing with me is that I took a flu shot about 2002, and that was the sickest year I ever had in my life. I was so sick. It did not agree with me. And my question is would I be safe taking the H1N1 flu shot? And the second question is, I have actually a family history where the pandemic of, I believe it was in World War I.
The 1918, yeah.
1918, thank you. I actually have postcards of a gentleman who was in our family who was in World War I. He was in Germany. And his family was from Oakley. Our family was from Oakley at the time, and they were discussing the fact that so many people were passing away of it. They were burying the bodies at night. Do you think that the H1N1 flu virus that we currently have roaming around is genetically or at even the protozoic level able to
Are they related?
Well, not so much related. I'm saying that at the genetic level, is it possible to have that virus change? I mean, and I know viruses change instantly.
Evolve into something else. Forgive me, Amber, I'm almost out of time, so I wanted to
Yes.
give the doctor a chance to answer the question.
Could they change to the point that we would have a pandemic? So
Right.
that's my two-part question.
A serious pandemic. We already have a pandemic.
That's right. Thank you. Those are very good questions. First of all, regarding your personal situation, you are somebody that normally we would say, yes, you should consider the shot, but because of your trouble with the vaccine in 2002, I would suggest that you talk with your doctor about whether the shot is safe for you. The other alternative the doctor could consider was that if you, let's say the flu got really bad and there were lots going around in your community, he could consider putting you on the antiviral treatment to protect you for a short period of time, let's say for a couple weeks if things were really bad or you were exposed to somebody with the flu. So
Well,
I would.
see, I deal with the public regularly. I'm in an environment with my work where I deal with the public regularly, and while we use hand sanitizer and I wash my hands frequently.
Okay. Amber, I apologize. I really do need to
Yes.
catch off because we're
Yes.
running out of time.
Amber, it sounds like you're doing what you can, but regarding your specific question about the shot, I would talk to your doctor just to be sure which is the best option for you. And regarding the virus mutating,
Evolving,
that
yeah.
other question, that was the concern this last spring. This virus is in the same family as that 1918 pandemic virus, so there was a lot of concern. So far, we're not seeing it happen, though. But as one of my favorite quotes I heard in the last few weeks from a CDC flu expert was, anybody who tries to predict the flu is a fool. And so one thing we know is we don't know what this virus is going to do. For right now, thankfully, it doesn't appear to be taking a nasty turn like the 1918.
And I'm going to have to shut this off. We've got one more caller. We'll get to the caller after we go off the air. So Bob and Rigby, hang on for us. Dr. Hahn, thank you for being here. I appreciate you joining us, giving us more information. If you want more information, check it out on the D4K, on the Dialogue website. Excuse me, the Dialogue website. We've got information there. Thanks for joining us for this Dialogue Web Extra.